All right, let's get started. So it's nice meeting you from back to the seats. All right, thanks so much. Thanks everybody for coming. So we're really excited to have this great panel today on broadly improving the policy relevance of health economic research. For those of you who haven't been here all day, we've had spirited debates about finite mixture models as a part of the annual Health Econometrics workshop. But we've also talked a lot, 3 papers on difference and differences, which I think, it's constantly evolving into something that we, probably the most policy relevant tool that we use these days. So we're going to pivot in a pretty hard policy applied direction for the rest of the day here and talk about how is it that we can improve the work that people in the audience are doing and in collaboration with you in the policymaking process and in the process of advising about policy and forecasting about policy. So before we get started, I just want to acknowledge for people who haven't been joining us today, we want to thank the Carey Business School and the Hopkins Business of Health Initiative for this space and for the hard work that they've done, as well as the University of Tennessee and an AHEW award that funds our conference every year, as well as the Stata Corporation. So everybody should have some Stata swag. So thank you for the resources that you provide. Let me introduce our great panel here. I'm going to have a conversation with them about some high level kind of broad questions that I have for them. And then at about 5 o'clock, we'll open it up for Q&A. So I guess I'll start at the end. So we have Marta Wosinska, who's a senior fellow at the Brookings Institute and has a lot of experience in government from the FTC to the FDA and OIG, and a PhD in economics from UC Berkeley. We have Chapin, who's the director of health analysis at the Congressional Budget Office and a PhD in health policy from, from Harvard. We have Tom Buchmueller, who is a professor of risk and insurance at the Ross School of Business at the University of Michigan and is currently the deputy assistant secretary at ASPE at HHS. And Meena Seshamani, who's the director of CMS and brings a wealth of experience, including an MD at Penn and a PhD in health economics from the University of Oxford. So very distinguished panel. I think looking forward to learning a lot from all of you. So I'm going to start with a common question for each of you that can serve as kind of a slightly longer introduction. But I want you to perhaps just tell us a little bit about, in your policy work or policy advisory work, tell us how you have used or are using health economics research that comes out of academia or think tanks broadly. And I guess we'll start with Meena.
Well, it's great to be here with all of you. So I think I can take it from both sides. So when I did my doctoral degree at Oxford, I was studying how healthcare costs are associated with age versus being close to death, because we could track data over 50 years and link to death certificates. And that research was actually utilized by the UK Treasury, because at that point, when they were looking at allocating funds across the UK, they were largely using demographics, but not really considering that someone from the north of Scotland lives a lot shorter life than someone from the south of England. And so there was a Wanless report a while ago. Derek Wanless was the head of the UK Treasury, where they were looking at changing the way that they were allocating their funding to account for the fact that, as people live longer, they tend to live longer in health and generate most of the cost towards the end of their life. And so just using strict demographics doesn't make sense for being able to allocate resources. Coming to my roles that I've had in government, certainly when I was in the Office of Health Reform and we were working on the Affordable Care Act, did a lot of work on evaluating microsimulation models that were being done by various researchers as we were thinking through how adjusting different parameters of health insurance coverage could lead to different behaviors of people in terms of what their choices are for health insurance. And I would say even now with the work that I'm doing, constantly looking at, I mean, like Marta, I read all of Marta's stuff for implementation of the Inflation Reduction Act, and even thinking through things like drug shortages and what are the incentives that exist in the payment system that are driving market behaviors, and what are ways to adjust those to try to address inefficiencies and imperfections in the market. So certainly from both perspectives, it's been very important to have that ability to translate research to the tangible policy.
So maybe it's useful if I just sort of describe what ASPE is, because I think maybe a lot of people don't know. The Assistant Secretary for Planning and Evaluation, we sort of think of ourselves as the department's internal think tank. So I'm in the Office of Health Policy. We've got about 40 researcher analysts that work on Medicare, Medicaid, Marketplace, and we do a variety of research that's focused on different audiences. So we have a lot of externally focused stuff, issue briefs, and there I think we probably use health economics research the way other researchers do, sort of building up the literature and sort of framing the work. We also do some internally focused work, where our audience is leadership. And there, I'm looking at Jessica Banthan, like this last year, a lot of the focus was on what's going on with Medicaid unwinding. The public health emergency ended, states were going to begin redetermining eligibility, and there's a lot of concern about what's gonna happen to coverage. And so we were doing some of our own internal work, but we really were looking at external researchers and really appreciated people like Jessica who had ongoing work and sharing it with us as it was, before it was published. And I saw that one of your papers just got published. And so that has been very valuable. And then AFP also coordinates something that's called, I'm gonna get the name wrong, Physician Focused Payments Advisory Committee, we call it PTAC. And we have quarterly meetings, and we bring in experts to help us think about new payment models. We work closely with CMMI, the Innovation Center, and just recently we had Randy Ellison to talk about some of his work and how it might influence some of the work that PTAC is doing and recommendations they make. And it went so well, we had him back just this week. And so we use sort of the ability to reach out to academics and help us think about a variety of things. And so we always appreciate when people are willing to come in.
Great, thanks for having me. And just to give a flavor of what the Congressional Budget Office does. So if you can imagine, it's nice to have this visual. Imagine folks in Congress going into the policy shop, and there are thousands of policy ideas, and they're putting together packages of policies and trying to move large legislative packages. What CBO's role is to put price tags on each of those policy ideas, and some of them are going to cost, some of them are going to save, some of them are going to increase revenues, reduce revenues, and CBO is putting price tags on each of these. And so when members of Congress are assembling these packages, it needs to add up, they need to get out of the checkout line. And so the prices that CBO is putting on each of these policy ideas is for better or for worse, is affecting what policies end up in those packages and what moves forward. So our work is very high stakes and very real world, very applied. This is not an abstract exercise. This is about real policies, real decisions are being made based on CBO's assessments. We never recommend for or against anything. We're just putting the price tag on things, and we always do it as straight down the middle as we can. In that context, we're drawing on many different information sources. We talk to people out in the world. We need to understand how the world works, how the policy would work, what it would do. We talked to folks in CMF, the executive branch, industry. We talk to everyone we can talk to. We run our own numbers, we build our own models. I was pleased to see there's some folks from CBO here who represent that side of CBO's work. And we read everything we can get our hands on, great literature. I don't like that term, but industry publications, publications from the executive branch, and output from the academic research community. So that's one thread that we braid together with other sources of information for this very platform.
Great, thank you, Marta.
So maybe I'll do what Meena did and sort of talk about my own work and the kind of work that I saw and we used when I was in various agencies. So I'll start with the agency. So it's actually fascinating to see how much variation there is across agencies and the extent to which they rely on research, academic research. So on the extreme where not only academic research is important, but there's tremendous interest in methods and really sophisticated methods is the FTC. A lot of this is that economics is so embedded in antitrust. You go to court, you will have expert witnesses who are economists. There, the stakes are really high. Methods, that's what you're going to argue about. So there, it was, everybody was on top of, what is the latest research. They organize conferences, they participate in conferences, they actually do research themselves. So that's one extreme that I think is, in a sense, very, very unusual for federal agencies. Sort of a little closer to, they still use some research, is the Food and Drug Administration. They do a lot of rulemaking. They do a lot of regulatory impact analyses, which is really a benefit cost analysis. And you have to kind of use economic thinking and thinking about the costs and benefits, unintended consequences. What's important there is getting good numbers that will then help you sort of quantify the costs and benefits. So, the economists would scour the literature to see, does anybody have a number that kind of fits, that captures the thing here? The method, it's not about the method, it's about the number. I think on the far extreme is the HHS OIG. They have their own methods, they have all their data sources, they can get their numbers, they have access to data like nobody else does. And so there was very, very little there of actually using external research. It was more sort of, I was the only economist at OIG, and where I played a role is basically helping them think through the problem. Thinking about unintended consequences, thinking about how pieces might fit together, thinking about how they should structure their research and their proposals. And frankly, now in my role at Brookings, I would say, and actually even looking back at my work as an economist at the FTC, where I did advise policymakers in the Center for Drugs around, how they should pursue their policies, I will say that probably the most impactful work the work that I've done that has had the most impact has not been about having a sophisticated model and being able to estimate a number really precisely. It's about helping policymakers to understand how pieces fit together and kind of give them a framework for how they should think through things and think about unintended consequences. And when I was at the FDA, when I tried to do a lot of outreach to academics and try to catch their papers really early on in the process, because two things would happen. A paper would be published, and then there's this afterthought, regulatory implications, right? Like, what does this imply from a policy perspective? And that usually was done after they wrote the paper. And the problem is that frequently researchers would not understand the regulatory context. They would not understand what tools the FDA might have versus not have. And they frequently would also not understand the data set that they were using. And so they would come up with these really bad policy implications. And so, again, research was really important, but for me, it was so important to engage really early on in the process so they can come up with actually sensible policy implementation suggestions.
That's really interesting. I want to pick up on one thing you said there, because I think it might be in contrast with the way CBO does it. So you're talking about picking up on the process really early picking up on a research project really early in the process. But it's the case that CBO can't cite things that aren't published. Is that right? Or no? No.
We can cite.
You can cite it, okay, that's clarifying then. But picking up on another thing, then, so you said that in some agencies, methods like the FTC mattered a lot, right? And then in others, it's just kind of explaining, kind of doing a better job of framing results. Can you, and this is to anybody in the panel, can you describe an instance in which methods really made a difference? So going from, and as an example, it could be an association to a kind of a plausibly causal effect, or it could be an improved diff and diff kind of estimate that previously, wasn't taking into account some of the things we know about now with the staggered time. Any examples that you can think about?
I mean, I can start. One of the things when I was working on the Affordable Care Act that I was often deployed to do was to ask lots of probing questions of the analyses that were being brought to us by lobbyists, right? Because you can uncover all sorts of selection bias in the data and kind of, how they're examining and what's causal versus correlation. And so definitely, quite a bit on that front. It was like kind of really evaluating the methods to see if what they were saying, made sense.
They just build a little bit on that, on the ACA. I think, I'm remembering when Sherry Gleed was about to be nominated for ASPE, she gave a keynote at AHEW, and she talked about like all the ways that health economics had informed the policy development, and I thought it was pretty impressive. But I think if you look back, one of the things that wasn't there was like really rigorous causal evidence on the effects of insurance coverage on health. I think there was a belief that it had to improve health, and there was a hope that it improved health. But Helen Levy and David Meltzer wrote a review paper, and they sort of concluded there's just not a lot of evidence. And Helen and I just finished an update of that paper, and the story has completely changed. I mean, with the new quasi-experimental methods, we have so many different good diff and diff papers, regression discontinuity. We have some experiments like the IRS sending out the letters telling people that they could get coverage. And the results are consistently finding strong evidence that when you expand insurance coverage, mortality goes down. And I think that's pretty impressive.
I want to introduce a dimension which is the transparency of the methods, and there's rigor, novelty, but transparency really matters for CBO. And CBO cannot go to Congress and say, we found this result in some paper in some journal, and here's your estimate. CBO analysts are producing the estimates, and we need to understand where all the results are coming from, how it all fits together, what the vulnerabilities are, the weaknesses of the evidence we're using. We have to be able to explain it. And it's a trust-based human interaction process between CBO and Congress. And for us to take on evidence, we have to understand it, believe it, be able to poke at it, see how it behaves. And so I just want to have transparency of methods and results on the table as a big plus. And I'm picturing some of those studies on health insurance coverage and mortality where there's a pretty simple figure where you can see accumulated mortality over time, and you can see the diff and diff, and that you can see it, you can explain it, you can bake it into CBO's results, and CBO's use those newer results on health insurance and mortality in some of our work. So.
I want to go back to something about benefit cost analysis, because I think especially at CBO, but maybe elsewhere, benefit cost analysis is often done by modeling at the agencies or at the agency. And most health economics research will be focused on the internal validity of a given parameter, but you often don't find then within those papers that they will do a benefit cost analysis. Do you agree with that premise, and do you think that that's the correct kind of division of labor? If the economists are producing the internally valid estimates, should we try to put those in some formal benefit cost framework or some within some model, or try to calibrate some model, or even estimate a model? Or is that are you happy with the internally valid estimate, and then you can use that in your own kind of simulation or modeling?
I mean, you can ask me, but Medicare doesn't do cost benefit analyses, so
Right.
there's my answer.
CBO doesn't do cost benefit analysis, we just analyze the federal budget. We don't measure quality or welfare, but the drive to internal validity often results in very narrowly tailored questions to take advantage of a clean specification, and it often that tends to miss the mark for what we need. And what we need is often fairly simple descriptive statistics and stories about how policy ideas like the one in play have manifested in the world in the past. So that we're looking for analogs, we're looking for descriptives, we're also looking for behavioral parameters, but an overemphasis on internal validity tends to miss the mark for what CBO needs.
I completely agree. I mean, the cleaner of an experiment you have, the better identification strategy that you have, you sort of found this sweet spot that just this, it captures this very rare time when things align in a way where you can identify what you would like to identify. And then you're asking policymakers to take that, and there are just so many other variables that are going to change what this would look like. So I'm not sure if the extension is cost benefit analysis, but yeah, there's just it can be really challenging to extrapolate.
Let's think about a specific example. So you've mentioned the Inflation Reduction Act, and Meena, maybe you can speak to this, but in the buildup prior to the passage of the act, what parameters were missing in the academic literature, or what parameters were you really struggling with to help you in thinking about forecasting the proposed legislation or implementing it afterwards?
Well, I think in terms of development of the legislation, that would be a question for Chapin, not for me. I think for us, as we were implementing, one of the strategic priorities that we had was really encouraging more real world evidence, post-marketing evidence for the drugs that were selected. And so as we put forward the guidance to set up the program, utilizing some of the guidance that FDA had put out on the rigor of analyses in a post-market environment, and building off of that, and providing information on what kind of data and analyses we would be interested in looking at for the selected drugs to help guide negotiation. And I will say, as we're entering into the second cycle of negotiation, remembering that it's not just manufacturers that we're asking for data from. I mean, if all of you are doing analyses on the drugs that are being selected, I mean, we are thinking about things more broadly than just what the FDA would consider for safety and efficacy, right? And really looking at what is the impact of a drug on a community in terms of health outcomes, and also in terms of, for example, downstream utilization and, prevention of further tertiary care. So, really it's a call to action to everyone that this is an area that, we are working very closely with FDA and also with NIH on, to really have more translational research, so that it's also about, like, when things come to that last mile, to the ground, what impact are they having? But Chapin, I don't know if you want to talk about leading up to the after.
Sure. Okay, so leading up to this is a nice example of our need for simple descriptive statistics. So the drug price negotiation is premised on a cap on the negotiated amount based on, and I apologize if you're not a prescription drug junkie, the non-federal average manufacturer price, non-FAM. We needed to know what is non-FAM relative to other price measures. And fortunately, we had done a paper in 2021 where we measured this. We have a special data arrangement with VA where we get their data pull. We put out a paper comparing different price measures. So we had a basis to say what non-FAM was. We didn't get that from the academic literature. It's not the kind of thing you would do as a dissertation, but we needed it. The other big piece of it was we have a negotiation bargaining model between CMS and pharma. We know the bounds of the negotiation. We know the best alternatives. What we didn't know was what's the bargaining weight. What is CMS's aggressiveness, sophistication, personality relative to pharma? But I don't know how you're going to write it.
They ended up with a physician and an economist in charge.
So we made a guess at that bargaining weight. We're updating that guess as information rolls out. But those are the kinds of things where analogs are helpful. How has CMS engaged in there's an outcome that could land between A and B, and is CMS eking out every dollar of savings, or are they kind of going a little easier on the providers? Like analogs, history, revealed, personality traits are what we really needed in that case.
So actually, I have a nice example from the FDA of where there wasn't enough of the right kind of research. So FDA actually ended up gathering a bunch of academics and then basically putting out a big paper on this. And it had to do with when the Center for Tobacco was stood up at the FDA, and all these regulations had to be done, and an economic regulatory impact analysis where economists needed to weigh the costs versus benefits of smoking, restrictions on smoking. And there just was not enough of the right type of literature and enough to cite credibly. And so I wasn't involved in this process. I don't know too much detail, but I do know that a number of healthcare economists got pulled into a room. I think ASPE was involved in this as well. And they actually put out, I think, a number of things, a number of reports that later on could be cited in the regulatory impact analysis.
It seems like with the IRA, one of the big questions, and really hard questions, is what's the impact on innovation? And I know that like CBO's estimate is often cited. That must have been a hard thing to sort of get your head around.
It's still hard. We are actively cranking away on that and updating. Yeah.
And how do you express uncertainty in that as it evolves? Does that, so I mean, it is.
At CBO, we express uncertainty in words, and I think sometimes people misrepresent that as being blind to uncertainty. But the thing is, our clients on the Hill follow parliamentary procedures, and there are points of order, and you need a binary: is the point of order sustained or not? And that depends on how the budget numbers add up, and are there mandatory spending impacts, and is pay-go violated, so on. So we present single number cost estimates to feed into the parliamentary process, but we are very aware of uncertainty and talk about it in words in the documents we put out. We also do more kind of conventional health economics publications where we do more conventional standard errors and confidence intervals.
It brings me to the kind of to the question of communication between academics and the policy world, because we have an example where we have a Tobacco Control Act that comes along. We need to stand up this regulatory arm at the FDA, right? And so it's kind of it's not an emergency situation, but you said that they just realized that they needed to get a group of academics together to kind of inform that. That's one example. But what are some other examples of channels of communications? I know CBO has a call sometimes for specific parameters or specific studies, and any of you can respond. Yes.
So I would say every time there is rulemaking, and there's a number of other opportunities where actually agencies ask for input, this is a great place to flag research to them or help them think through, here's something that you're missing. So writing letters, comment letters is a great way to actually get your research in the right hands. So that would be one way.
Yeah, I mean, I would echo that. For all of our Medicare payment rules that we put out, we asked for comment on the proposals that we put out, and we also ask for comment frequently on ideas that we want to get input on, to know which direction we should be considering. And so getting that input, from researchers is extremely important to us.
Great. So, in terms of improving communication, let's kind of think about relatively big picture things here. I mean, are there kind of 1% improvements that academics could be doing right now that would improve this communication? So one is responding to these, being aware of these situations in which there's a call or something like that. What are some other things, either in the process of producing academic research or just improving the communication?
I mean, if I can, I want to piggyback off of something that Marta said, I think in her opening remarks, which is, that the so what for policy ends up being the afterthought in the conclusion of the paper. And I think in some ways it does need to flip a bit. And I think that's where engaging early to know what the regulatory environment is and to think through the so what as you are looking at your methods, analyzing your results, because sometimes the so what you're trying to figure out, does impact what methods you'll use, because you need to be able to answer a question in a way that will make sense. And so, really being able to engage more in thinking about that so what, because, my team, the physician fee schedule, we get like 60,000 comments. So in order to digest all of this, I think having input that enables us to connect the dots to that so what is very important, and particularly where there can be analyses that synthesize across studies, right? Because you get conflicting results, but then at some point decisions need to be made. And so helping us to think through how should we examine when there are conflicting analyses, I think that would also be very helpful.
I would say, there are a number of economists in the federal government. It's actually a pretty large group, and a lot of them do research. And I think there is a value in establishing relationships with them. You will get to learn a lot about the agencies. You will get to hear what kinds of issues are on their radar screen, and you might learn about data sets that you didn't know existed. And, one way to do this is reach out. I mean, I've had people out of the blue email me when I was at the FDA asking me questions, and, it continues to this day. And I will refer them even now to like people at OIG that might know something, or, FGC and whatnot. Also, we have, for example, ASHE Econ. I was really glad that Tony Lusato did agree. I suggested to him, and I said, look, federal employees cannot, the government will not reimburse for their membership fees. They have to pay for out of pocket. And so then they don't want to go to the conference, and they have to pay the submed fees. Anyway, those were waived for federal employees, which was really great. And so they go to those conferences, but then what you will see is like everybody puts together their session, and then, the economists from the federal government are going to put together their session. Nobody goes to each other's sessions. That is such a missed opportunity. You guys should really know who does work in your space and establish relationships with them. And I think there's going to be a lot of opportunities from that.
And that's 1% is reach out with chapin.white@cbo.gov. I will route it to the right person. And I think the question would be, what could you use if you want to be policy relevant in the health economic space? We need results. We need help, and we're happy to talk about how to hit the mark. The other, maybe this is 2%. The other thing is more descriptives in your papers and your write-ups, and don't undersell the value of just the descriptives. They are used, they're needed, and they're undervalued relative to their importance in policy.
Tom, as somebody who kind of produces health economic research and then uses it in policy, are there ways in which your academic research has evolved differently as a result of your government experience?
Probably. Yes, my first stint in government was at CEA, like during ACA implementation. And coming out of that, I guess, like most health economists, I was looking how to do ACA work, and that, sort of a lot of it was more descriptive than maybe what I'd done previously. A lot of it was pretty short turnaround. Yeah, and I think I came out of that experience feeling like I understood the policy a little better, and I realized in the past maybe I was writing on policies that I didn't completely understand, and maybe that made the work less useful. But I definitely agree with the idea of reaching out to people and whether it's collaborating or just getting feedback. The idea of getting access to data sources also, I think, is really can be valuable.
Great. I mean, so you mentioned the ACA, and we actually, one of our papers today, we had a little bit of a debate as to whether it was kind of blasé and boring to be studying the ACA at this point. And I think journal editors, at least if you want to think about incentive compatibility here, journal editors have given the suggestion that perhaps the ACA doesn't teach us too much about the current environment. So do you agree with that statement, or is that something, are you still learning from the ACA in the sense that it informs current policy?
Well, I think, each additional paper becomes a little bit, more incremental, and so the diminishing return sets in. I mean, Chapin, you said something about what I heard is like looking into light post kind of research. You think about the ACA, there's so much work on the Medicaid expansion because like Republican states gave us this great source of variation. There's a lot of good research, but there's other aspects of the ACA that I think have been understudied because people didn't say, oh, I've got a great identification strategy. And I think, I think it'd be good to have more willingness to take on things like the marketplaces or, looking at the IRA going forward. It's gonna be really hard to, credibly identify certain parts of the IRA. That doesn't mean it's not important to study.
Yeah, go ahead. Just the context of the ACA was so different, and at that time we were dealing with different issues, I suppose. I mean, many similar ones, but just so many policy levers being pulled at the same time, from pay for performance to Medicaid expansions and things like that. So I mean, if we learn about an effect in 2014, does CBO still use that effect?
Yeah, absolutely, and we have noticed and written about this slowdown in the growth in Medicare spending, but in other federal health programs as well. The slowdown started maybe 2008, 2010, and we are very actively trying to figure out what pieces, if any, of the ACA contributed to that. That is a today question, even 14 years out, and it's not amenable to a clean identification, but we could really use help.
I think it has to do with what question you're asking about ACA, right? And to what extent the issue that you're trying to tease out still holds today. Some things might have moved on, but many things I would expect be the same. So I'll give you an example where there's very long lasting impact of studying really old hospital mergers. So for a very long time, there was a period of time where FTC really struggled with trying to basically prevent hospitals from merging, especially nonprofit hospitals, because the courts thought that nonprofit hospitals are not going to raise prices. And so FTC did a number of retrospective studies, they're not that particularly sophisticated, but sort of quasi experiments where they looked at a number of mergers between nonprofit entities, and they did find indeed it was very consistent. Their prices were increasing, and you couldn't really see the sort of resulting efficiencies that everybody was talking about when they were sort of trying to sell the merger. Now, would we think that now the mergers are somehow different? I don't think anybody would question that, right? So those old mergers and what was established there still very much hold. So I think it could be okay to study ACA, but the question is, what is the question that you're trying to answer? And is that a relevant dynamic to something that you're looking at today?
Anyone else? So I want to think a little bit about incentive compatibility though, because this is the group of academics, and we have a set of incentives that sometimes align with policy and sometimes don't. And so I've heard from the panel that descriptive statistics are really valuable, and kind of real-time descriptive statistics are especially valuable. And both of those are kind of difficult for academics and in a broad set of disciplines really, because our publication process is very long and oftentimes there's a hesitance to kind of publish descriptive results. So one question I suppose for the people on the more policy side is, are there ways that we can reward this kind of impact that would be visible beyond simply me going on Twitter and saying, hey, look what I've done, because I think that would really help the academic side if there was a clear, tangible incentive for this, aside from just a, civic duty perhaps to kind of help with this process.
I think you need to ask universities to figure that out.
I don't feel like you have to flip the question. It's on, if there is a value to engaging in policy, then that value should be reflected in how people are promoted and what's considered impact.
We're working on being more systematic about emailing folks who've done research that we're citing in our work, with the idea being put it in your tenure packet. But it's up to universities whether they value that or not. But I also just want to highlight you talked about the alignment incentive compatibility. Academia really rewards headline grabbing novelty. And boy, we need to know about all the null results, the boring results. This policy didn't do anything. And if you are an editor at a journal, let those through, please. We need them. And it's
You said put the question, but I was actually just trying to get you to say that for our editors.
So I'm coming at it more from like a academic perspective and like former faculty dean. I'd like to think that we do reward that stuff, but in a business school at least. We value impact on practice and policy. And maybe for the tenure decision, the best advice would be to really just focus on academic journals and focus on, the highest level journals in your discipline. But then after tenure, I think, good departments will be rewarding people that are having an impact and are visible and have sort of a balanced portfolio. So you can be doing your stuff that's targeted at top econ journals, but then also do stuff that's maybe more accessible to, in medical journals, health affairs, that kind of stuff. And we think about like the people who I think of as sort of the stars of health economics, they do that.
But I wonder if in part, having that dichotomy where you focus on like those academic journals to get to tenure and then you can branch out, leads to some of the, if you will, translation difficulties that occur between academia and policy. And it would be much better from the start that you are engaging, again, in more of that so what, building those relationships, right? Rather than later in your career, then coming back to do that because that wasn't something that was rewarded all the way along through your professional development.
Yeah, completely agree. I mean, what I collaborate with a number of academics, but because of this, up to tenure, all you do is think about the top 5 econ journals. My collaborators are tenured. Now they still want to publish in a top journal. But so the way we divide it up is we're going to write up some things for health affairs or publish it on the Brookings website. They're going to be smaller, more explainers. But then, you go ahead and finish it and publish it somewhere. So I think but I will say they are all tenured because they have a little bit more room to maneuver, which is kind of sad.
Could you, maybe to close, can you just highlight opportunities for more than just quick communication, but actual visiting kind of positions within your institutions? So I know Chapin was talking about a visiting position at CBO, but if maybe each of you could talk about those types of opportunities so that people who have perhaps a sabbatical leave or, a leave for any reason for 1 year or 6 months or something like that can take advantage of these synergies.
So we have visiting scholar roles at CBO, and actually Joe Levy, I haven't met Joe Levy, but he's just started. Oh, great. Awesome. Welcome. Thank you. We also have dissertation fellows and other ways to collaborate with CBO.
Brookings has visiting fellows and also non-resident fellows. So we're affiliated with a number of folks, Jonathan Gruber, Sherry Bleed, Michael Chernew are non-resident fellows. And you know, I was initially a visiting fellow. So but don't talk to me, talk to Richard Frank.
Our innovation center has some opportunities for people to be able to work for a period of time or to be able to have some of their time supported. But otherwise there's that interprofessional agreement, but that's mostly through ASPE. And I would say the rest of the Centers for Medicaid and Medicaid Services it's more like full-time. That's what I was saying. So the innovation centers where there is some opportunity.
And CEA is a great place to spend a year. I'd highly recommend that.
Well, and ASPE.
Yeah, we do, yeah.
Okay, so I'd like to turn to Q&A, but let's start by thanking everyone on the. Just raise your hand and be sure to introduce yourself. And we'll have microphones coming around.
Thanks for being here. This is really interesting. My name is Nick Papa George. I'm a professor of econ at Hopkins, but up in Baltimore. So I just had a couple of questions and comments. I mean, one, I wanted to say that it was nice to hear about crosstabs and descriptive stats being valued. I agree a lot. Also, I don't know, there's been some of these like very standard methods that we've been using for years and years are coming, they're being like interrogated a lot now, like diff and diff and whatnot, like what are we actually estimating? So, maybe some good old fashioned like regressions with a bunch of X variables aren't a terrible idea. And there is, work on like, confounding variable, omitted variable bias, whatever. And the idea that like there's better descriptive work that's probably more causal and worse. And maybe we shouldn't be so sanctimonious about it. The thing that was that I wanted to ask you is, well, kind of two questions. One is an easy one, which is for incentive compatibility, do you ever have some kind of deal where you like give access to data to an academic in return for getting stuff out of the data that you need? Because that's kind of, one of our currencies. No, but I mean, this is a real thing because I mean, it's not only that it's not rewarded to do policy things, it's sometimes like a demerit, like this person isn't serious, they're trying to be a public intellectual, they're not actually getting their stuff into journals. And so, I mean, I'm not saying that's how it was for me, but I've heard it happens. So one thing is just, that's very like incentive compatible and like, okay, here's this data set that it's really hard to get access to, we'll let you have it and, but in exchange we need a few things. The other, I don't even know if that's like a legal thing to do. And the other thing is, what do you think about what we would call structural econometric work? Because there are, I think, problems in, there's a bunch of structural people here, right? And that's, there are certain problems like healthcare markets, how they organize themselves that are like an industrial organization, and they're really complicated and like, I can barely understand them, but also they provide sharp answers to really complicated questions. How do you think about it? How do you not think about it? Is it worth even trying to translate it? Like, what would you consider about that? Thanks for listening.
At CBO, we would not just let somebody have our data and let them have at it. We have very strict security clearance. People, Joe Levy, you'll see this firsthand. People may come on and their visiting scholarship will be over before they are cleared for access to the data. So that kind of deal doesn't necessarily work. And also we can only really be using data to answer Congress's needs and questions. So that kind of exchange doesn't work. But there are other ways to find overlap and to meet Congress's needs. And then on the structural models, like I'm glad you flagged that they're hard for you to understand, that if there hard for you to understand, hard for us to understand. It can't just be a black box where we don't know how exactly the model landed on the answer and then use that answer. Like it doesn't really work because it just undermines the human trust relationships that have to be behind all of the work we do.
On your first question, I wonder if the most productive way to develop that relationship is with state governments. And I'm just thinking of one example that I've not been able to replicate. Tom DeLeer, when he was at the University of Wisconsin, did a lot of work with the state Medicaid office. And he did work that was sort of answering their questions. And in return, they let him use the data. And he published a lot out of it. And it seemed like it was a very nice cooperative relationship. Now, I've never managed to do that in Michigan, but I think that maybe state governments have a little more flexibility to do that, and they don't have big teams of economists that are already in-house, and so maybe they would appreciate the help.
That's still ongoing, it's called budget, and the team's still producing. Tom moved to Georgetown.
Yeah, Lord,
The budget team still exists and it's still cramping.
And I was just going to say, I mean, unless you have a formal agreement with the federal government, you are on an IPA, or you're not going to get access to non-public data. So the relationship is not going to help you. What I meant is that there might be some data that are publicly available that people just don't know about. So I was sort of referring to that.
Hi, I'm Marta Deb at Hunter College. I have two questions. One with my academic hat on, but I've been senior advisor at CMMI for 12 years now. So I do have the insight a little bit, and it has changed how I work, for sure. The question is is in reference to something Chapin said about kind of that shop of policies that you guys go into and you pull 6 off the shelf and that becomes the legislation. We like not to think about those multiple policies at the same time, but in fact, there is room for us to think about it. So that's incentive compatible, I would say, right? That we try not to, but we can. We have methods both in the structural space where it's multiple policies that are substitutes, partially complements that we can think about that I think we don't. But if you guys sort of shout saying we need, then I think that those things can get published. So that's just kind of one reaction. The other piece, having done this now at CMMI, having sat on kind of some of these ASPE things that go on, I guess I'm going to turn the 1% back to you guys. That would be great. I agree with everything you said about what we should do better. And I think maybe you guys should be kind of shouting a little louder, broadening the shout. The Federal Register is an impossible place for us to go find those questions. Many of these questions, I don't know if everybody would be interested in, but you don't need everybody. You need a couple of people to go, that's cool, let me do it. That's cool, let me do it, and I'm tenured, so I don't care, right? So, not just that, I'm public, so I don't even get a raise, so never mind. So I don't mind. But there are those people, but they will not find out until it's too late, right? And we don't have a sense of timeline. If you're going to give me 2 months to answer the question, I can't. But I know that some of these roll around for years. And had we known ahead, right in the beginning, at the inception, we might have been good partners. I just want you guys to think about it.
I think maybe the way to address this is to build in these kinds of sessions into a lot more conferences, but not just to talk about what research, but ask policymakers what is on their mind and what are they worried about, and what do they think is going to be down the pike that's going to become an issue. And if I were to say why I have been able to be relevant with my work is because I try to talk to not just actually, by the way, not policymakers, by industry as well, and try to understand what the pain points are, and then say, well, how could I inform that? And so I try to kind of be a little bit ahead of the curve before something blows up. But that requires a lot of conversations, and I think, you know, it's hard for policymakers to organize conferences for academics, but academics organize them, just invite them. And I think you could get a lot more insights. I'm sure Meena has a long list of things that she's like, you know, that she could give you of things that she's worried about kind of down the pike and, you know, the trends that she's concerned about, and we will need to be watching this, can we be modeling this, and how, et cetera.
Thanks so much for coming. I'm Maggie Sheehan, Chicago. I want to ask sort of just a practical question, and this is coming from like a relatively junior perspective. When you say ask policymakers, I mean, can you describe some examples of venues through which to do that? And I can give a sort of real life examples. I'm working on a project which was actually very much inspired by a Senate Aging Committee report commissioned in 2023 by Bob Casey. And we've been working on it, we've been reading the report, super excited about it. We've been like staring at the CMS org chart, looking at all the like sort of directors that are in this area. We've submitted FOIA requests, we've like learned kind of inside out as best as we can from the outside. Yeah, so we just don't know. We would love to engage with policymakers. Clearly, like it's something that policymakers do care about. But we're a team of like 3 relatively junior academics. We don't like know anyone per se. So where do we start? Like, do we talk to like the people who wrote the report in the Senate? Do we reach out to CMS? Do we like go down the org chart and just start cold emailing people? Just some examples of like how can we access you in a way that's not one of 60,000 sort of comments in the Federal Register.
So I had a general question, but it might not apply as well to CMS. So my recommendation is look for economists in the respective agencies, sort of fellow researchers, and sort of start there, and they can help you sort of find your way around. I mean, that's what I did at the FDA, and I'm quite sure if current folks were to be paying, or if you know, with at HHS OIG, go to the chief healthcare economist, and you know, and look also for reports that agencies might have done, and see sometimes they have authors there, right? So that would be my first suggestion. It's a little trickier with CMS because they don't have this big econ group you can go to and find some economists there, but
Economists, but I actually think, you know, people are publishing things in health affairs, they're publishing reports, and seeing who the authors are and reaching out, I think is a really good way. The other thing that I would say, I mean, yes, I totally agree that the Federal Register is like impossible to navigate. But where, like the conferences, I think are a really good avenue where there are people going, talking about the work they're doing in the agency that can then spur the conversations about what could be helpful that researchers are doing. And in particular, there are requests for information that come out outside of the big payment rules. And a lot of times those are some of the multi-year, you know, where it's like, hey, we want to do work in X area, give us ideas. So a lot of times it's some of those standalone requests for comments that are very helpful. And that's where then you can like engage, where it's like, okay, then you want to set up a meeting, like that's where a lot of that then happens.
I'll just add one more thing. I know that there are a couple of folks that compile lists, and I think one is in collaboration with AEA. I think Marta Starr is doing something with them for the AEA, pulling together basically information about new rules coming out and also comment letter requests. So I can try to send you the couple of examples, but they're really nice compilations about what's going on in the federal government and where there's a way to insert yourself.
Arman.
I'm Arman Vasu, University of Washington, Seattle. I really enjoyed the talk and the discussions. You know, one of the issues that I have seen when producing academic research that could impact policy is that we're often uncertain about the decision criteria being used to make policies or evaluate policies. And a classic example, Dr. Seshamani, is the IRA kind of price negotiations, right? We have some vague parameters about what would be used to negotiate prices. We can certainly infer certain things that what, you know, the cost effectiveness of stuff that we are producing. But is there anything new that we need to do those price negotiations? Is that what we are doing enough, or we should be doing more? Often it's not clear to us, the type of research that we needed, or we should be weighing more, because we just do not know what evidence is being given more weight than the other in making policies. And I wonder, I mean, obviously there are political economy of making that more transparent, but I wonder, is there a way to make those things a little bit more transparent for academics to produce better research?
Yeah, I mean, I think, we mentioned the, requests for comment that occur both within our regulations and then the standalone ones that are put out, which again, I will say, for those of you interested in CMS world, all get put out on cms.gov. And so just monitor cms.gov, which is much easier than monitoring the Federal Register. The other avenue is our information collection requests. So where we're putting out, it's called the Paperwork Reduction Act, which is like the sexiest name on the planet. But anytime you want to collect information from more than 9 entities, you have to go through this whole process of putting out, here's what we'd like to collect. Then you have a 60-day comment period where people can say, no, don't collect that, collect this instead. Then we make edits. Then there's a 30-day comment period. And we have all of these PRA packages, that's what they're called, that give like the specifications that we're looking for data. So for example, for the Inflation Reduction Act, we have a whole series of PRA packages where we're specifying this is the kind of data that we're looking for that would be a good thing to look into.
Hi, my name is Kezia Edmondson. I teach health policy at the Uniformed Services University, and I was actually invited here by my health economics colleague. So we do collaborate a lot there, but given that the way that we look at these problems, the way that we analyze, write about them, teach about them is so different, do you have any thoughts on how we can kind of merge the two together a little bit better in terms of publications, journals, things along those lines, so that you kind of have both of those perspectives together in one product? And then additionally, do you have any suggestions for teaching the next generation kind of some of those collaboration methods?
So I guess like my question is, does it need to be one product, right? I mean, I think that's exactly, there are different audiences. So when I'm collaborating with academics, we're going to be writing on the Brookings website for just general audience and policymakers. I might submit a comment with, I've submitted comments with some of my academic colleagues, to CMS. And then we're trying to do a paper that is in the same space, but it's really the empirics. And then the other paper, we just sort of highlight the empirics, and then we publish it in an academic journal. So I'm not sure that it needs to be in one, but I actually think because there are different audiences, you need to write differently, you need to include very different information, but it's almost an opportunity to do more things.
Any other questions?
I'm Melissa Grado from Boston University and the Boston VA. Can you give some advice to all of us, regardless of level of experience? How much detail is useful? So in my VA work, a lot of times our operations partners want 2 sentences. I'm assuming more detail than that would be useful in a request for information, but just a little bit of guidance on how to tailor the information we're providing so it's actually useful on the policy side would be helpful.
I think in part it depends on who the audience is and what the question is about. I do think more than 2 sentences is helpful, but diving into like the real intricacies, not as much. I don't know, that's probably not very helpful, but
I think the big picture and how things fit together, contextualize the numbers, like explain why what the agency is doing. Don't just say, this is not gonna work, here's the right number, but sort of really do some of the explaining and how things fit together and why they will or will not work, why there might be unintended consequences. So I think I would say it's more words than that. And then you know, to the extent that we can take a deep dive on something, that's fine, but stay at that higher level, bigger picture. Oh, and remember that non-experts will be reading your work, so whatever you write.
Yeah, like definitely the acronyms, like not there, because you will have people who are not familiar, especially with the methods and coming back to the so what.
Other questions?
Right, I'm Austin Benter from Davidson College. So there was a talk about or discussion about uncertainty earlier in the estimates that you made. But I also wanted to ask whether you also worry about just being wrong sometimes in the decisions you make because of how you may have used like some sort of descriptive information to make a decision. And so the two levels thinking, how much you worry about being wrong and how much do you have in the internal processes to track how well you've done over the last decade or two, and is there any interest? Because part of it being simple and having descriptive is that you might also miss something that could be really important. So, how might you worry about that?
I'll start a lot. Most of the work CBO does is on policies that don't get enacted into law, and then there's no factual counterfactual. Some does. Typically, the effects of policies are blended into the stream of history, and it's very hard to disentangle what actually happened relative to what we said would happen. Once in a while, there are things like CMS putting out a press release saying prices are 22% lower, and we said they would be 50% lower. Like, that's awkward. And we pay a lot of attention to both to like when things play out differently and it's hard to disentangle, and when it's very clear and blatant. But we're constantly updating our models, and we get a lot of pressure from our clients on the Hill. Why did you get it wrong? But what are you doing to get it more right next time? So we're constantly updating and improving.
To follow up on that, I mean, in instances when you've been wrong, I mean, can you pinpoint the most common reason for that? I mean, is it just because the evidence is, kind of shaky at best, or like you said with the drug negotiation, you were just kind of searching for these parameters that maybe didn't exist, and is that the primary reason for being incorrect, or is it that the setting of the parameter was just totally different, or some external validity problem or something?
Big new systematic changes, or just standing up a new system with a new set of players and new objective functions and a lack of history to draw, and that's the hardest for us to do.
London.
Just turn around. I think there's really no substitute for actually going in and participating in government for some period of time. I think you might be. Yeah, personally, it's good. I'll live again forever. But I wonder if people like are very much you could say that if you've done an IPA or done an extended CEA. And it's anyone in the room who wants to find out what it's like, there's a lot of people who are moving, I think, so that's more, and it will change your life forever.
I think that's a good place to end. So let's thank our panelists one more time. We'll get to better logistics for those who are with the conference. We're going to Zaytinya tonight for dinner at 5:30. So I think most of us will walk. It's a beautiful night. But if you prefer not to walk, please see me and we'll figure out some logistics. So thanks.